Good morning, Nursing 204. Today is a very big, full, exciting day. We are going to do a video on wound care. And this is kind of involved, as you can see behind me. There are quite a few things written on the board, but we're going to go through everything very detailed, and I will do my best to explain so that you understand what the process is. So, just so you know, what we are teaching will be sterile technique. What you will find, quite honestly, when you get out into the field is that it will be a clean technique. We feel that it's very important to protect the patient and do a sterile wound dressing change just to protect the patient from any sort of bacteria, which, as we know, then creates infection. So we are very cautious and careful as we do wound care, and that is what I'm going to teach you today. So on the board behind me here, we've written down wound care supplies. There is also a form that you can access on the computer that gives a list of these sorts of supplies, and it also gives a little bit of a step-by-step process for doing wound care. So you will see that the list is fairly lengthy. It's really important. Create a card so that you have a supply list, so you know exactly what you're going for. When you go into the supply room, you're collecting all your goods. Get a little basket or something to put them all in so you have them all collected and all ready to go. Just try very hard to think ahead and be organized, because that will be key and will help to expedite the whole process, and you can move through this in a significant time, that's for sure. Just know, however, when you first do dressing changes, it's gonna take a while, and just be patient with that. It's a-okay. We all started there, so you can't start doing this skill and be an immediate expert with it. That's impossible. So just kind of relax and breathe and go through the steps and do the process, okay? So I've written some things down here. You'll want some regular clean gloves. You're gonna want some chucks. And we've got some chucks right here under the patient already, a pad. You want some adhesive remover. Usually they come in little pads. So you're gonna want adhesive remover when you take the tape off. You're going to want a sterile drape, sterile towel. You're going to want sterile gloves in your size. So you'll learn to know what your size is for sterile gloves. You're going to want a tape measure. We've got that right here. It does not have to be sterile. You are going to want some sterile gauze. I've got 2 packages right here. You're going to want a sterile Curlex, which is the gauze that comes in a roll, as you can see here. You're going to want a sterile Abd pad, which is this pad right here, and usually it's a larger dressing. There are 2 sizes. This is a 7x8, and I believe there's another one that's 8x11 or something like that. It's pretty large, but you'll know which size you want. You'll be aware of which size you're gonna want. You're gonna want a bottle of sterile packing. You're gonna want a culture tube. You're gonna do a wound culture, so we'll show that. You're going to want sterile Q-tips. 2 packages of sterile Q-tips. You're gonna want some tape. We call this toilet paper tape because it's kind of perforated, but you can, oh, not this one. Oftentimes it is perforated like toilet paper, and so you can just tear it. This one is a different kind, but we have scissors, so we'll be just fine. Then you're going to want a bottle of sterile water. You're going to need this for irrigating the wound. You're going to want the irrigation tray with the syringe in it. You are going to want sterile scissors, like we were just talking about. sterile scissors and sterile tweezers, and I apologize, I don't have a sterile pack for our sterile tweezers. So we're having to just fake it today. Then you want some skin prep pads. They usually come in little packages, kind of like the Adhesive Remover. You're going to want a couple packages of those. You're going to want a Sharpie. So that is kind of your grocery list of things that you are going to want. So let's go ahead and get started. We have Jane's butt here, and so we are going to go ahead and do this dressing change using her hiney. So initially, I'm going to want to set up my sterile field. Getting a few things cleared off here, excuse me. So we are going to open things up and have the sterile field set out. I'm not going to put on my sterile gloves yet because we have some clean work to do before we start doing the sterile wound dressing change. But initially, excuse me, I'm going to move things over here. Let's get things set up so that we are ready to go. So, I'm going to open up my sterile drape. And bomb drop. I'm going to lay out my things here. Okay. Then I'm going to drop my sterile gauzes. Bomb drop. And you can just get things onto the field, and once you get your sterile gloves on, bomb drop. Once you get your sterile gloves on, you can arrange things exactly the way you would like them. You can flatten out your drape. You can do all those sorts of things that we as nurses like to do. Oh, bad.
Do over. Do over.
Do over. Absolutely. You didn't see that. There. Oh,
Take two.
Take two. That's right. Exactly. My dear Karen's in the background. I love it. My wound culture. Whoop. There we go. My Q-tips, maybe. Oh, come on. I think the hardest part sometimes is just getting the packages open. Come on, buddy. There we go. Oh, no.
I forget. So you have to hold the paper and pull the plastic.
I did it backwards. My bad. Okay.
I remember.
Oh, man. Fail. Hold the paper and pull the plastic. See, I heard Karen say this on our other video, and then I screwed it up myself.
Okay.
Oh! Got a little zealous there. Okay. So your sterile packing, you're going to want to open up the bottle and set it off to the side. Your sterile irrigation tray, you can handle this, but what you're going to want to do is you want to pop the syringe onto your sterile field and have your bottle right here. Okay. Then you want to pour your sterile water. This is a brand new bottle. Otherwise, I would dump a little bit before I I forget the term, Karen. What is it when you spill a little bit out of the bottle before? Oh, okay. Never mind. Never mind. Sorry.
It's called lipping, but when
Lipping.
when you use a bottle, it's already been used.
Been used. Okay. So I'm going to pour some solution into my irrigation container there. Good. Now I'm going to put the lid back on again. Good. And I need my sterile tweezers. Boop. I opened that sterile package and popped those out. I need my sterile scissors. I think I've learned with the tweezers, huh? And our sterile Curlex. There we go. And then we've got our tape right here and our Sharpie and our skin prep. Okay. I believe that we are now ready to begin the work on Jane's butt. So we're going to do a little camera adjusting here. So bear with us. Don't get seasick. There we go. Okay. So, initially, you went to don clean gloves. So just grab a pair of clean gloves. Because initially what we're going to do is we're going to remove the old dressing. So get some adhesive remover tape. This is really an important thing to do for your patient because you want to make certain their skin is really fragile. If they have a significant wound, their skin is really fragile. And taking the tape off, tape is very irritating to the skin. Adhesive is very irritating to the skin. So just be kind and remember to use your adhesive remover tape, okay? And I should step back for a moment and say, you want to get the patient positioned in a comfortable position and a position that's workable for you as well. Do not stand in precarious positions. Make certain that you are getting your work area in a good position for you. You want to make certain that the patient is comfortable, but also do it to yourself and protect your back, okay? You need it for many years, so don't hurt it now. That's for sure. So I've got some adhesive remover here. And you want to just go along the tape here and just help to loosen that from the patient's skin. Just keep on wiping around. Make certain that you don't get down into the wound, but just keep coming along here. Go on top of the tape here and just help to loosen this and get that dressing off. Good job. So now then, to continue, inside the wound is sterile. To continue to protect that, you grab a hold of the dressing right here and then just gently grab a hold of the gauze, everything that's inside there, and take out the dressing. And you put it to the side on a chucks. And yes, you have placed chucks under your patient. Now then, I don't know if you can see it or not, there's a little white spot in there, right in there. That is the packing, and it is inside the wound and it is considered sterile. So we will not be getting that out until we have our sterile gloves on. We'll use the sterile tweezers to pull that out, but for right now, as best you can, you want to get the dressings, the old dressings out of the wound. Now then, we are going to use a hover method and measure this wound so that we know what the size of the wound is. So this is just the outside perimeter. So you measure from noon to 6 and from 3 to 9. You use those two forms of measurement always consistently. Then everybody knows kind of where you're going from, because as you can well imagine, if you start doing it like from 2 to 7 or 8, it's going to be a different measurement than 12 to 6. So always do 12 to 6 and hover over the wound. So I'm kind of at a precarious angle here, but hovering over the wound. So 12 to 6 is 175 millimeters, which would be 17.5 centimeters. So you can use your Sharpie pen and write it on the edge of your dressings there, or on a piece of paper, put it in a place so you don't forget it. Then from 3 to 9, I'm hovering once again, and I measure 140 millimeters, or that would be 14 centimeters. So that is getting the outside measurements of the wound. So, good job. Moving along. Now then, we are ready to go ahead and don our sterile gloves. So, you'll want to get rid of your clean gloves there. And excuse me, I'm sorry we ran out of space a little bit. I'm going to don my sterile gloves. Now that I have my sterile field right here in front of me, so I'm not turning my back on my sterile field at all. You want to make certain that you don't do that, because if you turn your back on your field, you have no idea what's going on behind you, and the possibility of contaminating is significant. So getting these gloves on. You're going to have some fun with practicing this once you get your little packets. We're excited for you to come and get your little packets and come see us. And oh, okay. So once you get your gloves on, then you can get your fingers arranged in the proper places. Okay, good enough. So now then, what I'm going to do is I want to get this packing, this piece of packing out. So I'm sterile. These are sterile tweezers. I'm going to reach in here and pull out the little bit of packing. And I'm going to put this off to the side over here so it's out of the way. I'm going to need these tweezers again so you can put them back on your sterile field. Now then, I'm going to take my sterile syringe and place it down into my container and draw up irrigant, the sterile water. I'm not touching the syringe anywhere other than, okay, I would not do this normally, but I'm going to so I can show you. I draw up this irrigant. I'm not touching the bottle. I'm just doing it. I'm putting the syringe in there and drawing up my irrigant and moving along, okay? Not touching it so that I am contaminating. And then what I want to do is gently irrigate the wound. So you just gently irrigate and clean the wound. Get around the outside edges and get that all clean. And then you use your gauze. And you want to just gently dab in the wound and get all along the edges of the wound too. You want to get that tissue moist again. That helps. It helps to just kind of hydrate the tissues, and it gives it moisture in those areas that can kind of get dried out. So gently just dab. You don't want to rub. These tissues are very fragile. When there's this large of a wound, this tissue is very fragile. And you know, believe it or not, because there is some nerve involvement, sometimes the patients don't really have a whole lot of feel. Sometimes they do. When it gets down into more deep areas, oftentimes they will still have some of that feeling, but you want to be careful. And just make certain, we call it tunneling. That's when the wound creates little holes. It looks like a tunnel. There can be little holes where the wound has advanced and grown deeper. So make certain that you get down in those areas. Now then, you want to take a Q-tip. The video will tell you to use the pointy end of the Q-tip. We have had a few mixed feelings about that. I will use the pointy end today versus the soft cushy end, just because sometimes this end can be more abrasive to a wound, and so this is a lot more gentle on the wound. So anyhow, we've seen both ways. I prefer the Q-tip end, honestly, but we'll do the Q-tip cotton end. We'll do the wood stick end. So I'm going to go into the area where the wound is the deepest, which I'm seeing it right here. And then I go to the edge of the skin. I measure. And you want to hold it pretty perpendicular to the wound so you're getting a good measurement. So you kind of have to eyeball it. I'm going to break the stick right here, and then I will measure this when I'm done so I know how deep the wound is. So you want to do that. Now then, we've cleansed the wound and kind of gotten the extra tissue off and everything. Now what we want to do is we want to culture the wound. So you get the wound culture, whoops, to the green dot. You get the wound culture tube and the Q-tip. So what you want to do is you want to go in the wound, and where you see some exudate and all, that's what you want to get your Q-tip moist with. Just kind of go to your deeper areas there. Then you unscrew this. There's a little cap on here. Oop, green dot. Sorry. Oh dear, my brain. Then you'll see down here at the bottom, there's kind of a jelly substance. That is part of the culture for the Q-tip. For it starts to help to grow whatever bacteria or anything that's in the wound. It starts to help the growth of all that. So you squish this to make certain that it is getting on the Q-tip. Then what is very important, please, please, please make certain that you identify things on this tube. You want the patient's name, the date of birth, wound culture from decubiti wound. You could just say decubiti wound, date, time it, and be the hero and put your name on there and take credit for your hard work. Make certain all this is on the tube so that it is properly identified for the testing of it and everything, and they know which patient this is for. In a facility, it can be multiple choices for who this wound culture is from. So please, please, please make certain to identify it. So put that off to the side. And now then, we are ready for some fun. So I'm gonna break sterile technique here so I can hold the bottle up so that you can see. This is called wound packing. And what you will see is it's this long continuous strip of packing. So you want to pull out just a small amount of what you're gonna use in the wound. And then you are going to want to cut that with your sterile scissors. So see, I only have, whoop. Oh,
Redone.
I need practice, that's right. You're only gonna get a very small amount, and then you can use a Q-tip and you can pack it down in that area that looks like it's tunneling. Make certain with the Q-tips they have kind of a sharp pointy end. Make certain that you aren't digging into the tissues, but use the Q-tip and just poke it down in there. Get it packed in that area. Do you know what the purpose of this is? This sort of packing, what it does is, the way the strip is, once again, it kind of creates a channel for pulling drainage out, pulling the exudate out that can, if it's sitting in that area, it can get infected and it can start to create more tunneling, and it can create a site for infection. So it's very important that you put the packing in there to help with wicking that out. That's what it does. It wicks it out. So now then, we get to have some fun of packing. And you want to use a Curlex. So what you want to remember is that you want this Curlex to come all the way out to the outside edge. I forgot one more thing. Excuse me. Back up, back up, back up. You want to get this gauze wet. So with the rest of your water in your, it's best to keep this in the packaging to do, but you want to get your gauze wet. You want it to be, that's pretty good. You want it to be like a wet sponge that you can't really squeeze much out of it, but you want it pretty soaked. So, sorry, I get to talking and giving instruction and I forget. So, now then, you want to make certain that you are laying this down on the wound bed, and make certain that this part is pulled out. You don't want this folded over. The reason for that is it can put pressure on the wound. So make certain that this end is kind of frayed out there. Then you want to start laying it inside the wound here. And you can use your Q-tip. Make certain that you are going out to the outside edge. It wants to stick to the Q-tip there, so I'm just going to use my fingers. Then when you get to this other end, you can twist the gauze. That kind of helps to create a curve with the straight gauze. Bring it on down, curve it. You can come around the side here to get to your outside edge. Get that covered. You only want to go to the outside edge. Give your curve again. And you want to zigzag this back and forth in the wound and make certain, sometimes for Jane's Hiney, you could probably even do 2 Curlexes. I didn't twist at that end. I probably should have, but let's twist it down here. You get hung up in it sometimes. So just zigzag it back and forth and fill in this space right here. And just keep it going. Keep it going. You want to use up the whole roll of Kerlix. And when you're taking the dressing out, pay close attention because you may need to run. There may be something that got added to the dressing change and you don't know that that's a new supply, so it may not be on the original list. Always check the care plan, see what it's been updated with, so that you aren't forgetting anything, because the worst thing in the world is to be in the middle of a dressing change, you're in the middle, you're sterile, and then you realize you don't have something and nobody's in the room with you because everybody's busy, because there's a lady who's trying to elope that's down the hall. Notoriously, it happens in the middle of sterile dressing changes. So anyhow, I did not mean to drop that. You want to pay attention that you aren't dropping the gauze outside in the area that is not sterile. Keep it going and roll it all the way to the very end. And just like the first end, you want to pull this out and make sure it's frayed so that you aren't, it's not doubled over and creating extra pressure in the wound. So there you have it for that part. Then, thank you. Then for your ABD, so it comes packed, it comes in a trifold like this. So what we recommend for opening it up so you aren't touching the inside, grab this edge, pinch this edge, and pinch this edge and open it up. And as you can see, it gets kind of stuck down there. But do not touch the inside of this. You want that to stay, even though you are sterile, you don't want to touch this part. You want this only to go up against the patient. So you put this over the wound, and sometimes you have to kind of pay attention to where you need to pay attention to where the edges of the wound are. You do not want this, let me see if I can pull this up and show you, green dot. So you see there's kind of this little seam right here. You do not want this over the wound. You only want the cottony part of the pad over the wound. So make certain when you lay it down that you have covered all those areas. Now then, us humans, we have very fascinating anatomy. And oftentimes you have to be really creative as a nurse in trying to figure out how you're going to tape this, because Jane's hiney hole is right in here, probably where your tape, you would want your tape to go. So be incredibly careful. We're going to have to be a little bit creative. Sometimes you can just pull that corner back, pull it back like this. See how I've made that kind of a little triangle there. And then we're going to tape right across there, and it will avoid going over her hiney hole. And as you can well imagine, after patients have had bowel movements, dressings get soiled. And do you need to change them after that happens? Absolutely. They need to be changed because you do not want stool going into this wound. Jane's having problems enough with trying to heal this without any extra challenges. So do your best. Another helpful thing to do then is use your green dot. Oh my, your non-sting skin prep. There we go. So put this on the skin. It just really helps. It kind of creates, when you put it on your skin and touch it, it almost feels kind of like you have tape on your skin or something. It creates
Water barrier.
Yes, water barrier. Exactly. And it just kind of creates this on your skin. It's a very interesting thing and stuff, but I recommend it. So go around for the skin prep, go around where your tape is going to go. Do this to protect the patient's skin. It helps. The tape kind of sticks to that barrier piece versus sticking directly on their skin. So go ahead and get that taken care of. Now then, I don't have the toilet paper tape, so I am going to have to use scissors and cut my tape. So initially, I'm going to tape, so do your hardest areas to tape first. This is the kind that has the paper, kind of wavers back and forth, the wax paper part of.
You fold it in half. It works better. The other way, lengthways. There you go.
Oh, Karen just taught me a good trick to fold that in half. Good job. Even old dogs can learn new tricks. You betcha. So make that little triangle and tape this little precarious spot first. Get that on there, and then you can remove the tape and have it adhere to the skin. There we go. Now then, tape is kind of an interesting product all its own. If you are having difficulties with tape adhering to the skin, tape reacts to heat. So if you're putting tape on and the tape's just wanting to peel off, just sit there and hold it for just a minute. The heat of your hands will help to kind of soften the adhesive and help it to stick to your skin a whole lot better. So just take one brief moment, absolutely, and just hold it. Hold your hand on there to just kind of add a little bit of extra heat, and you will find that you will be more successful with your tape adhering. Okay, now then. What do we do? I've got some more. Thanks. Okay, Karen had great advice. Fold it in half this way. Thank goodness I haven't used this very much. In all honesty, I'm used to the toilet paper tape. I love the toilet paper tape. You will too when you start using it. Except toilet paper tape and gloves. Oh my, I'm just creating a mess now. Okay, well, this is quite humorous. Sorry. Yes. Thank goodness Karen is here to help me. She heard my cries for help.
Oh, really old tape.
It's old tape and it wants to stick to the paper. Oh, but Karen's doing it. Karen's doing it. Yay, Karen. Thank you. I needed you. You came right at the nick of time. I love it. Oh, ta-da! Karen's wonderful. I love it. Okay. Go ahead and get this part. Now we'll see if I can get it off. And get the other edge and get that removed. There we go. There we go. Try and keep the tape smooth so you aren't getting any wrinkles on the patient's skin. As best you can. It can be a challenge. Okay, we're getting there. Slow and steady wins the race, right? Oh, hello. I guess this one's pre-measured. It works pretty well. Okay.
Here's the bottom corner.
Is that okay?
For this bottom.
This here?
Yeah.
Okay. Okay, then I'll trade you. How about that? That works. That works. Teamwork. Yes, if you can have a buddy, I highly recommend it because this can be challenging as one person.
Especially with this type of wound and it's so big.
Yes, this sort of wound is so big, and just you know, getting it all taken care of and managed is extremely important. So true. My Karen is helping me ever so much. Yay. I think one more. We have just enough. Wow. Boy, I don't think we could have calculated this one any better if we tried. Oh, I got a little bit of a wrinkle there, but oh, good job. Good job. Oh my goodness, that turned out perfectly. Oh my goodness, we're just so good. There, voila. Okay, then the last thing that you want to do is just cut a little strip of tape. We don't have any more at this point, but we recommend using a Sharpie pen and writing on another piece of tape and put date, time, and take credit for your hard work and put it on the dressing so that it is marked. Then you definitely want to do charting. For charting, you want to do date and time of when you did the dressing change. You want to talk about doing a wound culture and talk about it getting sent to lab. You want to talk about the wound. You want to talk about the measurements. So I did this one short Q-tip, and let's measure that real quick so we know. And that measures out at, I don't know if you can see it, but 65, yes, millimeters, which would be 6.5 centimeters. So you would talk about the tunneled area. The depth of that is 6.5 centimeters. Otherwise, the wound was 17.5 by 14, I believe it was, for my initial measurements. So you want to talk about that. Then you want to talk about the wound itself. What does it look like? I took out the dressings. The dressings are moderately saturated with serosanguinous drainage, noted purulent drainage from packing tape, slight odor noted, tissue inside wound bed is pink, no areas of necrosis noted, edges of wound appear to be granulating with, That just means that there's new tissue growth. So, and then any other, how the patient tolerated it, any other, if you pre-medicated the patient before the dressing change, you would want to address that, and give any sort of pain scale ratings from the patient, any sort of patient interaction that way. Please chart it, and as best you can, try and use the patient's words, their specific words. That just kind of gives your charting a lot more credibility as you quote what the patient said. So I believe that is it. It's kind of long and involved, but you can do it, and we just have great faith in you. Don't think you can do it really fast the first time you do it. Give yourself time to learn how to do it and do it right. So thank you very much. Take care. Bye for now.